I want you to take a moment to think about one of the youngest members of your family. And when I say young, I mean a family member or maybe a very close friend that would be about 3 to 5 years old. I want you to think about that person. Keep them right there in your mind, and I would like for you to close your eyes for a moment. This is Claire. In the summer of 2019, Claire's eyes became crossed, her balance was lost, and she lost control of her arms and legs. On July 2nd, 2019, Claire received a heartbreaking diagnosis of DIPG, a terminal and inoperable brain tumor. Claire's team of doctors gave her a prognosis of 9 to 15 months left to live. Now I want you to continue to think about that person, that young person in your life, and visualize that I'm reading about them. Claire courageously underwent 33 sessions of radiation under anesthesia, countless doctor's visits, avistatin treatments, pokes and pricks for blood and urine tests, MRIs under anesthesia, and ultrasounds, and the list goes on. Now, continue to think about that person. Keep your eyes closed and think of your loved one. On February 28th, 2020, at the age of 4, Claire Hernandez was called home to her Heavenly Father in the arms of her mother and father. Surrounded by her family and loved ones, Claire took her last breath on earth. This is Claire, and she was my son's best friend. They were in pre-K together. She was 4 years old. She had 2 older brothers, Gavin and Logan, who loved her dearly, along with her mother and father. She is a very special little girl. When I received the text message from her mother, it brought me down to my knees. I had no idea what DIPG even meant. Never heard of it. Of course, we hear about childhood cancer, but I had never heard of this. And why is there no survival rate? It just was very shocking to me. And so, what is DIPG? It's diffuse intrinsic pontine glioma. And a child diagnosed with DIPG today faces the same prognosis they would have received 40 years ago. That says a lot. There's no effective treatment whatsoever, and there's no chance of survival. 200 to 400 children are diagnosed yearly in the United States. And what's worse is DIPG exclusively affects children between the ages of 4 and 11 years old. No one knows what causes DIPG. There's no evidence that links DIPG to inherited genes or anything like that. It also accounts for roughly 10 to 15% of all brain tumors in children. So what is it and why is there no survival rate? And what are we going to do for future generations? It's a tumor that starts in the brainstem, the part of the brain just above the back of your neck, and it's connected to your spine. Your brainstem controls your breathing, your heart rate, and the nerves that help us see, hear, walk, talk, and eat. As the tumor begins to grow, it puts pressure on the nerves that control the essential bodily functions regulated by the pons. These children commonly experience double vision, reduced eye movement, facial weakness, or asymmetry. They also have arm and leg weakness. Children with DIPG also experience problems when they're trying to walk, their coordination, their speech, chewing, swallowing. As the tumor progresses, it also interferes with your breathing and your heartbeat. And that essentially is what results in the child's death. So medical advances in the past 40 years have greatly improved the survival rates for many children diagnosed with cancer, but not for children with DIPG. The survival rate for children with acute lymphatic leukemia has increased from less than 10% in the 1960s to nearly 90% today. Overall, the survival rate for children with cancer is typically about 83%. But these medical advances, they've done nothing for children diagnosed with DIPG. There's no effective treatment. There's no chance of survival. Only 10% of children with DIPG survive 2 years following their diagnosis. That's less than 1%. The median survival rate for a child with DIPG is 9 months from their diagnosis, and Claire would fit in that statistic. In the past 30 years, DIPG patients have participated in more than 250 clinical trials. Sometimes the trials have been done alone, and other times a combination with other drugs. None of these studies have shown any benefits whatsoever. Parents are their biggest advocates. In the early 1970s, a group of parents of child with childhood cancer formed Candlelighters. It's now known as the American Childhood Cancer Organization. They lobbied Congress for childhood cancer research funding. Their efforts have led to increased awareness of the devastation of childhood cancer. They've designated pediatric oncology program funding with the National Cancer Institute, inclusion of pediatric oncology, and development of information and support programs with the Candlelighters. But I would like to talk to you about one of the biggest organizations that's near and dear to my heart that involves Claire. It's called The Cure Starts Now. They're dedicated to finding the home run cure for cancer by focusing on one of the most rarest and most aggressive forms of cancer. They've funded over $14 million in cancer research, resulting in 90+ cutting-edge research grants in 15 countries since 2007. Their vision is, if we can find a cure for DIPG patients, then you can find a cure for all cancers. This cancer is not rare and it's not fair. One of the biggest ways you can help today is to look into DIPG. How can we help these families? How can we find a cure? If we can find a cure for this, we can find a cure for all. It's so important to think about what we can do today to help so many families. Nobody should be reading an obituary for a 4-year-old that has cancer. So please consider looking into The Cure Starts Now.